So the brain breakdown. All right, let's talk about what we have here at PAM. This is unique because no other program is like this in the world. But if you walk into any rehab hospital or any nursing home, you'll see a big sign that we have a stroke program. And so everybody and his brother has a stroke program, but they're pretty much all the same. Nothing unique about it. And I'll show you a lot more about that as we go. But the difference between us and them is we have a whole neurochemistry component of this. So we have to block this destructive sequence, and then we got to rebuild brain. And we've got great therapists, some of whom are here today. Not all of them here today are good therapists, but the ones that are here today, they passed their tests, so they are basically good. So the difference between us and them is that we have this Clarke Neuroregeneration program. This is a protocol. This is something that has developed over the past 35 years, and it starts back in the day when we didn't even know we had stem cells in the brain. But we're going to talk about that. The whole idea was, how do you make these stem cells turn into brain cells and then network into the other cells that are already there? The moral to the story here is that you can do all the therapies in the world, but if you don't have the neurochemistry as part of it, you can't make new brain, and you can't protect the brain that is trying to get damaged and give up the ghost. So this is what we have here, but we have physical therapy, occupational therapy, speech language therapy, but what's this chemistry part? And that's what we're going to run through today. So here's the story of Isaac. He's a 20-year-old Marine. He's walking around and decides he's going to go out on Friday night with all his buddies, and he has an accident when he's ejected from his car at 100 miles an hour. And that's what's left of his car, I guess, there in that picture. Not much to it. So he sustained a skull fracture and multiple hemorrhages in his brain, and he was like a wild animal when he got to the hospital. He didn't get much better when they transferred him over to a long-term acute care hospital where they are initiating his rehab. And at that particular hospital, they call me if they have one of these crazy patients, and they say, what are we going to do about this? So this is in North Carolina, so I give them the whole protocol. This is what you need to start. They get the labs, and they implement them in that patient. So he was wild, he was choking people, he was hitting people, he beat up a couple of nurses, and but in less than 24 hours after starting this protocol, he started talking. And this is from his attending physician. He said, implemented the recommendations you gave for Isaac early in the morning, and in the afternoon he was calm, talking, following commands. Have you seen these changes in such a short period of time in your traumatic brain injury patients at your hospital? And yes, we do. That's the difference between what we do and what everybody else is trying to do. So where's this patient now? Well, he continues to take this stuff called Nupanex, and I'm going to talk about that in a minute. And he's continuing his rehab, and as an outpatient, he has better speech and mood and function. And so his mom writes back, and she says, Isaac's doing great. His recovery continues to amaze us. It's truly amazing. He's still getting occupational therapy, speech therapy, physical therapy, vision therapy, recreational therapy, kinesiotherapy. So he's still in therapies. That's the idea. You got to be therapies, but you got to have the chemistry too. And his mom gives the Proverbs 3, 5, and 6, which is trust in the Lord and don't lean on your own understanding. So what happens after the brain injury? What happened to Isaac? When a brain cell is injured, it starts out with just a single injury. So the cell gets exploded, so you have the membranes are compromised. So the contents leak out, and these contents include free radicals. You know about free radicals, so antioxidants to scavenge your free radicals, and excitotoxic neurotransmitters. Those will damage the cell next to it. So it keeps on going in this horrible sequence of events. So eventually you've got this explosion of ever-expanding brain damage after one cell is damaged. It happens with strokes, it happens with Alzheimer's slowly, it happens with concussions, even in all the kids that get hit in a football game. and end up lying on the field seeing stars, that's a brain injury. It happens in everybody that has some trauma to the brain, even though it seems minor. So the first step is to stop this destruction. We got to stop these balloons from popping. How do we do that? Well, we first have to know what's involved. We have these free radicals that escape. They damage the cell next to it, as I explained. And the second thing, we've got these neurotoxins. We have excitatory neurotransmitters inside our cells, which are great when they're in there, but if they escape after the membrane is damaged, then they kill the cell next to it. Then you get more free radicals, then you get more. So the next stage is inflammation. So after the cells are damaged, the immune system in the brain says, hey man, we got to clean up this mess. So you get these inflammatory cells going out. You know about cytokines. You remember the cytokine storms that used to get in the COVID pandemic? The same thing happens anytime there's brain damage. So the inflammation then is damaging more. It's supposed to do good, but it doesn't. It ends up damaging more cells. So we got to stop all of those things. Free radicals, excitotoxic glutamate, which is the excitotoxic bad neurotransmitter, and the neuroinflammation. So do we have that does that? Well, at PAM, we use this stuff called Nupanex. Nupanex stops that destructive sequence, and I'll show you how. So the things that are in Nupanex are all these little supplements, and there are no drugs in Nupanex. All of these things do exactly what I said. So we have PQQ up here. PQQ, and now this is science talk here, but it suppresses all of those free radicals. Vitamin K2, you know about K2. It works to help make bone and protect your vascular tree, but it does that by blocking these free radicals. So we've got K2, we got vitamin D, it does the same thing. Most importantly, I think, is melatonin. I think we ought to be giving melatonin even before heart surgery, because it scavenges those free radicals that happen after they do the bypass graft. So melatonin is not just a sleep vitamin, it is a brain protector. And we also have acetylcarnitine down here and CoQ10. You know about CoQ10 a little bit? Not only do they scavenge free radicals and suppress that oxidation release, but it also makes the energy inside all of the cells. We need a lot of energy because we've got to make new cells. If you don't have energy, the cells are just going to sit there and they're not going to reproduce. But we also have to suppress that neurotoxin release, the excitotoxic neurotransmitters. Well, the same things do that. So that's all part of Nupanex. PQQ, it stops that receptor from binding, so we're blocking it, so it diminishes the excitotoxicity. And each one of these things do exactly that. They either, in some way or another, they block that excitotoxicity. So now we've stopped two things. We've stopped the oxidation that's deadly to the cell next to it. We've stopped the excitotoxic neurotransmitter release that happens when the cell is exploded. And the final thing is we've got to get rid of the inflammation, because we got to stop that, because that's going to kill more cells. So every one of these things does exactly that. PQQ suppresses these interleukin and C-reactive protein, all these bad interleukin 10s and tumor necrosis factor alpha. All of these things are things you probably heard about during that COVID pandemic when they talked about how bad the inflammation was after the pandemic. Well, these same things suppress that. So we've done that. We've stopped the destructive process. Even after a patient has a stroke or a brain injury, months later, they're still having these destructive sequence happening. There's still oxidants out there. There's still damage. We need to stop that and stop this free fall. So even after we see patients in the hospital all the time that have had a stroke or a brain injury, and we think, okay, they're doing better, but the damage is still ongoing. We still have to stop this destructive sequence. It's even more important probably in dementias. So we don't really realize what's going on behind the scenes in a dementia, but the same destructive process is going on there. But we're talking about brain injury here. So how do we fix it now? We've stopped the destructive sequence. We've stopped the free fall. Now we got to bring them back up. We've got to bring them back to life. And the thing that we can fall back on is the fact that we have stem cells in our brain. We didn't know that until the early 90s. Now we know it. So from that point on, I just began to study what does the stem cell need to make it grow, to make it turn into a neuron, and then send out all its axons to connect into the network. And that's what I've been doing for the past 40 years. So the thing that actually makes it happen is this neurosteroid is what we make. I'll tell you what those are in a minute, but they stimulate this thing called a sigma-1 receptor. And that turns this stem cell into a brand new brain cell. So that's what separates us from all the other rehab facilities. Nobody else in the world is doing that. And I'm going to show you that I have proof that it works. But the important thing to remember is when you see we have a stroke program at our institution, ask them if they can rebuild the brain also, because they can't. All right, so we need to activate these neurostem cells to mature into new brain, and we've got to drive this sigma-1 receptor. All right, so let's look at what is a neurosteroid. Well, one of the things that is in Nupinex is DHEA, and the other one is pregnenolone. Those are the main hormones that stimulate that sigma-1 in the stem cell to say, hey, I feel like growing up. I think I'm going to be a neuron. So that's the key to making new brain. We know that's true, and even Wikipedia, the fountain source of all knowledge, will even talk to you about that. It talks about this DHEA and pregnenolone. These are the two neurosteroids. It says these neuroactive steroids will activate this sigma-1 receptor. It will stop the excitotoxicity, the oxidative damage, the mitochondrial dysfunction, and all of that. DHEA is a great thing for potential treatment in the various neurodegenerative disorders. And it goes on, the sigma-1 receptor holds promise in application and potential therapeutic target in the treatment of neuropathologic diseases. Not just brain injury, but everything. So we need those hormones. So the Nupinex has DHEA and pregnenolone in it as well. So we've stopped the destructive sequence, now we're rebuilding, and now we're driving the sigma-1 with those neurosteroids. So now we put that together in the rehab hospital with practice, 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 which is what these kids do in the therapies. And that's a stroke program. That's a brain injury program. Now here's the thing that people don't understand. Cholesterol is essential because the sigma-1 has to have cholesterol for it to work. So the cholesterol will bind to this sigma-1 receptor and then it turns the switch on. So we need cholesterol. The other message you need to take home today is you've got to have cholesterol in order to make new brain. So you can see that from cholesterol, you make all these neurosteroids. Look, you got pregnenolone, which I mentioned, and it was in the Wikipedia, and DHEA, which is also in Nupinex. All of these things that we think of sex hormones, estrogen, progesterone, testosterone, actually make new brain. So the worst thing we've ever done, I think, in 2001 is to take everybody off their hormones. They didn't want to give testosterone to guys, or it's going to cause a heart attack. Didn't want to give estrogen, progesterone to anybody because it's going to cause breast cancer. All of that turned out to be doing more damage than it was preventing. Now we know that because a new study that came out in 2024, I think, or 2023, that shows that these neurosteroids, estrogen, progesterone, testosterone, DHA, they all make new brain. They prevent dementias. So why did we take all these people off their hormones at that point? We made a big mistake, and we're still making it. And not only that, we stopped their cholesterol. So we got to get rid of their cholesterol, they said. We got to get rid of these hormones, the very things that make new brain and repair them. So here's the neat thing about this cholesterol cascade. You have this HMG-CoA, and statin drugs block it, everything south of that. So all of these things go away, or they barely work. So yeah, we achieved our purpose. We got rid of the cholesterol, it dropped, hey, great. But along with that, we can't make new cell memories because it's all cholesterol. We can't make new myelin, which is the insulation wrap around the nerve fibers. So And from that, cholesterol also makes all these hormones, as I just showed you. So we're not making hormones, we're not making new cells. So we have a brain damaged kid that has no resources with which to make new brain when we take away their cholesterol and their hormones. And even worse than that, if it could get worse, ladies and gentlemen, if it could get worse, it blocks these isoprenylated proteins. This Rho and this RAS protein are the things that copy the DNA of an old cell and make a new cell out of it. So we're regenerating cells. So we're blocking our own cell reproduction. And it's not just happening in the brain, it's happening all over. It happens in wounds. How are we gonna get wounds to heal if we don't have cholesterol and we don't have this system working as it's supposed to work? And you've probably read or seen the commercials about CoQ10. CoQ10 is also eliminated when you're on a statin drug. And that's why you see commercials that say, if you're on a statin drug, you need to be taking CoQ10. Because we already talked about, it's involved in all of the neurodestructive sequence. It's involved in making energy in all the cells. And there's this cell regeneration is horsepower intense. So we've got to have all of that energy from CoQ10 and carnitine and all the things I just showed you, all the stuff that's in Nuponex. That's why statins should not be used in neurologic injury, especially in a concussion injury or brain injury. We're desperately trying to stop this sequence, and yet we've sabotaged the whole repair system by doing that. So here's another case that I think is probably going to show you that we can actually do this. This is a 28-year-old kid that was assaulted in a knockout game. So he's walking casually down the sidewalk and somebody hits him in the back of the head right there at the brainstem. Well, when you do that, all the transmission from the brain to the muscles goes away. It's completely eliminated. So he just collapses. You can't catch yourself with your arms. You can't even roll to the side to make sure you hit a shoulder instead of a head. They go straight down. So he hits the back of his head, and he hits it in this typical thing called the coup injury. That's the back of his brain. Right here he has a skull fracture and a bleed into the brain. And then the brain sloshes back into the front of the skull, and he hits in the front. So now he has brain bleeding in the front, which is the contra-coup, and he has the coup, which is, of course, the brain fracture and the bleed. We did a second CT scan here, and it still shows some edema here in the coup area, but some of the blood in the front of the brain is starting to resolve, but you can still see there's some edema, there's some still fluid, so there's still a lot of inflammation there. So this was back in 2017, I think, yeah. For the next 6 years, this poor patient just kind of floundered around. He had to quit his job. He couldn't think. Everything was a fog. He had dizziness, which is almost incapacitating. So he was pretty much figured, well, this is my life now. I'm not going to ever get it back. So he heard about me and he said, I think I want to try this program. So we started him on Nuponex. And what we wanted to see was whether or not we really were making new brain. And we are. And here's how this is. This is called EEG coherence. And the way this works is we did a baseline study here. These 4 figures here are his baseline. Then we started Nuponex. And 30 days later, we did another one. And so we get all these same 4 wavelengths, but look at the colors have changed. So what does that mean? That means that the brain made new connections. So up here, each one of the black dots on each of these graphs are the electrodes in the helmet. And the computer takes that information of the electrical activity in the brain and it figures out what part of the brain is connected to another. This is the front of the brain, this is the back of the brain, this is the right, and this is the left. So in each of these figures, that's what this is. So we're looking at all these connections in the different parts of the brain. So look where we're getting these connections. We're getting new connections. Every red line is a new connection. So we're seeing new connections at the back of the brain. Remember where he busted his head and he had all that edema? And the front of the brain, right where we see that stuff on the CAT scan. So he's repairing the brain in the very areas that were damaged in the coup contre coup injury. Nobody's ever shown that before. This is really exciting. So we know we've made new connections. So what does he say about it? He said, I feel normal again. In 3 months, after 6 years of being in a fog and dizzy, after 3 months on this Nupanex program and brain injury program, his brain repaired and he started feeling like he's normal again. And we have absolute proof that we made new connections. So in that regard, we're working with Pam. Pam has a collaborative endeavor with University of Houston here in Clear Lake, and we're studying this. What we're doing is we're trying to get some of these patients into our facility. We start them, we get all their baseline data, and we track this over with our normal therapies. We get baseline therapy data, and as they finish their rehab, we put them over at Clear Lake, University of Houston Clear Lake, and in our outpatient thing, we have a protocol we're going to put in place for that. And we continue to follow them, and we collect this data, and the data that's going to hopefully change the way we deal with brain injuries. And this data will probably come from this WAVI EEG coherence. So nobody has ever done this before. We're doing it. We know we've got recovery of function. We know that it works for sure, because this is not something I can just generate randomly. It is actual data from his own brain waves. So when you put all that together with physical, occupational, speech, and language therapy, you've got the practice, just like the little girl that plays the piano. She's got all this youthful brain chemistry going on, and she's 10 years old. She practices, and within a couple of weeks, she has made those connections. Those little stem cells that she has as a 10-year-old began to form their new connections. And they never go away. When she's 70 years old, she'll still be playing that same piece of music for her grandkids. That's how this can work. But you gotta repair the damage, you gotta stop the damage, and then you gotta repair the brain. And that's what we do with our PAM study. So when all of the neurochemistry is present, just like that little 10-year-old girl, you can make brain, but you still have to practice. You still have to practice the piano, and that's what we do in our therapies. It has to be a combined program of neurochemistry and therapies. That's what we do at PAM. That's why we're different from the rest of them. We have to stop the free fall damage, and then we got to start the repair, and everything hinges on this combination of chemistry and therapies. All right? Thank you for coming.